What is the link between PTSD and bipolar disorder? Have you ever wondered how two seemingly different mental health conditions can be connected? Post-traumatic stress disorder, or PTSD, and bipolar disorder, or BED, are distinct but often coexist. Research shows that up to 50% of individuals with bipolar disorder also experience PTSD. This is a significant overlap compared to the general population. On the flip side, the rates of bipolar disorder among those with PTSD can vary widely, highlighting a complex relationship between these two conditions. One of the primary links between PTSD and bipolar disorder is trauma exposure. Traumatic experiences such as domestic violence, sexual assault, and parental neglect are common risk factors for both disorders. While trauma does not directly cause bipolar disorder, it can trigger or exacerbate symptoms in individuals who may already be genetically predisposed to it. Additionally, there may be shared genetic vulnerabilities and neurobiological pathways that connect these conditions, although the exact mechanisms are still being studied. When someone has both PTSD and bipolar disorder, they often experience more severe symptoms. This can include heightened depressive and manic episodes, increased sleep disturbances, and a greater number of psychiatric hospitalizations compared to those with bipolar disorder alone. Individuals with this comorbidity also face higher rates of suicidal thoughts and previous suicide attempts, indicating a more complex and potentially dangerous clinical profile. Treating someone with both PTSD and bipolar disorder presents unique challenges. Standard treatments for PTSD, like antidepressants, can sometimes trigger manic episodes in those with bipolar disorder. This is particularly true for individuals with rapid cycling bipolar disorder. Therefore, it is crucial to focus on psychosocial interventions that specifically address trauma symptoms. Trauma-informed care approaches that recognize and treat PTSD symptoms within the context of bipolar disorder are recommended to improve overall outcomes and reduce the risk of suicide. Given the high rates of comorbidity and its impact on the severity of illness, it is essential for healthcare providers to routinely screen for PTSD in individuals diagnosed with bipolar disorder. Integrated treatment plans that address both mood symptoms and trauma-related symptoms can lead to better management of both conditions. Understanding this relationship is vital for effective diagnosis, risk management, and tailored interventions that can help individuals navigate the complexities of living with both PTSD and bipolar disorder.